I have the honor of introducing our presenter today, someone I know quite well. So I want to start first, though, by paying respect to the Algonquin people, who are the traditional guardians of the land where the University of Ottawa is located, and which remains unceded, and so pay respect to all Indigenous people who call Ottawa home. And we certainly at CRECS, we acknowledge the traditional knowledge keepers, both young and old, and we're privileged to learn from them on various projects. I'll tell you just briefly a little bit about our presenter, Dr. Elisa Romano, who's been with us, God, since 2004. I don't know where the time went, eh? And she's a full professor in the School of Psychology. She's also director, co-director of the doctoral clinical psychology program in the school. She attended, well, what I consider the best clinical program that in the country, the University of Manitoba. You can guess where I'm from as well in terms of my graduate studies. But after completing her PhD in 1999, Elisa went on and did the postdoctoral work at the University de Montréal. And she also worked there as an associate researcher. Her work looks at, examines, investigates the mental health of children and youth who've experienced child maltreatment and family violence. It does really interesting, practical, important research that's really all about developing interventions in this area. She's also a clinical psychologist, member of the College of Psychologists for Ontario, and does work in the area of child maltreatment, anxiety, mood disorders, behavioral difficulties, and parenting challenges. And her work, her research has been recognized with awards from the University of Ottawa. She received in 2016 the Faculty of Social Sciences Excellence in Research Award, and more recently she received the University of Ottawa Excellence in Research Award in the Humanities stream, and that's quite an honor, because that's among all the professors across the campus in the Humanities stream. So it's a pleasure to welcome Elisa and hear about the SafeCare program for child neglect. Take it away, Elisa.
Thank you so much, Tim, for your kind words. I really appreciate it. And thank you to CRECS for this invitation to present, and also for beginning with the land acknowledgement. So I look forward to sharing with you the SafeCare program and some of the work that we've been doing with this program over the years. So although I'm presenting on my own today, I do wish to acknowledge and thank the many individuals who have contributed their time and expertise to advancing this work. In particular, the families who completed the program and shared their experiences through our research study, the agencies that have adopted the SafeCare program and are collaborating with us, the undergraduate and graduate students who have devoted their time to advancing the research, and my colleagues here in Canada and in the United States. So I'll start by presenting some information on child neglect and the SafeCare program, then highlight some of our past research findings with the program, and end with an overview of the current research initiative. I'll present in English, however, feel free to make any comments or ask any questions in either English or French. So let me start by just kind of explaining how I came to work with this program, which comes out of the United States and is housed at the National SafeCare Training and Research Center in Atlanta, Georgia. I heard about the program at a conference a little over 10 years ago. I learned about its focus on families with young children from newborn to 5 years of age, and the particular attention to child neglect, which is a form of interpersonal trauma with high prevalence and incidence rates. and which has serious long-term impacts on children's development and functioning. I also learned about the program's development and its focus on proximal risk factors of child neglect, with the understanding that neglect is always situated within a broader context of adverse community and social circumstances. And finally, I learned about SafeCare's evidence base, not only in terms of improving parents' ability to safely care for their young children, but also helping to reduce the future occurrence of neglect and other forms of maltreatment. So inspired by what I had learned about this early intervention program that can really help to keep families together, I returned to Ottawa and began reaching out to various child welfare agencies to begin a conversation around whether such a program might help to address the needs of some of the families with whom they work. So there was definitely an identified interest and a need for a program like this, because there are very few well-researched programs for this form of maltreatment. It's often known as the neglect of neglect. So we prepared and obtained a research grant to implement and evaluate SafeCare within Ontario Child Welfare. And we've been working with this program since that time, since 2013. So that's how it kind of began with SafeCare. Taking a step back, though, in terms of why a program like this might be important, I would like to present some incident study. So these are data from the Ontario Incident Study of Reported Child Abuse and Neglect, which is a primary source of provincial incidence data on child maltreatment in Ontario. So the OIS tracked the number of new child maltreatment investigations for young people under the age of 16 in a representative sample of 18 agencies in the province of Ontario during the fall of 2018. And the information was gathered through forms that were completed by child welfare workers about the child maltreatment reports received and the investigations that were carried out by their agencies. And then from this information, provincial incidence rates were estimated for the whole year of 2018. And what the findings indicated is that there were close to 150,000 maltreatment investigations that were conducted in Ontario in 2018. 2/3 were for abuse and neglect, 1/3 for concerns about the risk for abuse and neglect. And then from all of these investigations, 26% were substantiated. So among these 38,000 investigations that were substantiated, neglect was identified as the primary concern in 21% of those investigations, making it the maltreatment type with the second highest incidence rate. In this study, as in many studies, neglect was defined as follows. The child has suffered harm, or the child's safety or development has been endangered as a result of a failure to provide for or protect the child. So neglect includes acts of omission, such as failure to supervise, which can result in physical or sexual harm, physical, medical, dental, educational neglect, failure to provide psychological treatment when needed, and abandonment. Of course, determining the true incidence of child abuse and neglect is very difficult, because it's well established that most cases of child maltreatment are not reported to either child welfare or police. In the Ontario Incident Study, there was no information included, obviously, about unreported maltreatment. It also didn't include cases that were only investigated by the police. And it didn't include reports that were made to child welfare authorities but were screened out before there was an investigation. So those numbers are really on the conservative side. So these next set of data also come from the Ontario Incident Study, but they specifically examine data for Indigenous children and youth. And before I present them, I just, of course, want to acknowledge that these data must be understood within the context of colonialism and its effects in terms of historical and intergenerational trauma. So what we see from these data is that in Ontario in 2018, for children under the age of 16, child welfare investigations were approximately 3 times more likely to involve a First Nations child than a non-Indigenous child. And then if we look at, what were the primary concerns, we see that the highest proportion of maltreatment investigations involving First Nations children were for neglect, at a rate of almost 40 per 1,000 First Nations children, compared to a rate of about 8.5 per 1,000 non-Indigenous children. So that's it for in terms of incidence data. I'd like to now turn to etiology and the causes of neglect. The causes of neglect are complex, numerous, and they often involve multiple layers of interacting systems in which children and families find themselves. There are risk factors at the macro or the more distal level, as well as risk factors at the more micro or proximal level, things within the family and within caregivers. And of course, there are all these bidirectional and overlapping influences between and among all these various systems and levels. So here in this slide, I've just summarized some of the data from a recent meta-analysis, as well as a recent literature review on the causes of child neglect. And I won't go through each one. I just wanted to highlight maybe a few points from the slide. One is that you see financial hardship and poverty mentioned a few times. And undoubtedly, financial hardship often makes it very difficult for parents to meet the needs of their children and can often force them to prioritize some needs over others. Poverty can lead to parental fatigue and stress, and these individuals might be parenting alone with few safe and reliable social supports, while also struggling with the challenges of community violence, as well as their own history of trauma and adversity. However, it's really important to remember that neglect is not synonymous with poverty. And in fact, neglect has a number of detrimental effects that extend beyond those of poverty. Also, poverty may be associated with some specific subtypes of neglect, such as inadequate food access, medical neglect, and neglect due to inadequate supervision. The other thing I just wanted to point it out from this slide is that these factors that contribute to neglect also contribute to other forms of maltreatment, in particular physical abuse, which is often found in homes that are also experiencing neglect. And then the final point is that for the child level factors, the intention is not at all to suggest that children are responsible for experiencing neglect. Rather, it's to highlight the reciprocal nature of child-parent interactions. So given the multi-layered etiological factors and the fact that neglect often occurs early in life, when a child is rapidly developing, the impacts of child neglect can be quite profound and quite long-lasting, and they can cut across many domains of well-being and functioning, including cognitive functioning, mental health, physical health, academic, and interpersonal. That's sort of just setting the stage in terms of incidents and causes. I'd like to now turn to the actual SafeCare program. So, given the complexity around neglect, how does a program like SafeCare really fit, right, within this landscape? And it fits by addressing the level that is most proximal to the child and that is best suited for a clinical intervention, and that is at the level of the caregiver or the parent. At the same time, there's an understanding of the many additional supports that families experiencing child neglect need, and the fact that many macro level changes are required with regards to things like financial supports, access to childcare, and supportive child welfare services. Given that many families experiencing child neglect are involved with the child welfare system or with community-based agencies, there is the opportunity to work with families more closely and over a greater period of time so that SafeCare can be one part of a more comprehensive plan of care for a family. So SafeCare is an evidence-based in-home program for parents of young children under the age of 5 or 5 and younger with concerns around child neglect with or without the presence of physical abuse. In terms of whether a family might benefit from what SafeCare has to offer, some questions are around, are there concerns around the caregiver's ability to engage, bond, attach with their child? So are there concerns at the level of the relationship? Are there concerns about the caregiver's ability to sort of structure their young child's day so that they're engaged, to stimulate it? It's a way to also prevent challenging behaviors. Are there concerns around managing the child's challenging behaviors, maintaining a safe home, and making really good health decisions for their child? And if the answer is yes to any or all of this, SafeCare might be an option for families. A variety of caregivers have benefited from the SafeCare program, and this is mainly because SafeCare is a skills-based curriculum, and it builds on the knowledge, the experience, and the existing strengths of the caregiver. And it can also be delivered in a way that fits with a family's needs and preferences, even though it is a structured program. The curriculum is currently available in 2 languages, and we're in the process of translating it into French so that it can meet the needs of our families here in Ottawa and within Canada. So the SafeCare program includes 3 modules that help parents build skills to ensure the health of their young child, the safety of their home. It helps parents to build a sensitive and responsive relationship with their child. And it teaches skills around structure and predictability in their child's daily living activities. So here is just some examples of the material that a SafeCare provider would present and work with vis-a-vis a caregiver. And also caregivers are provided with many resources across these 3 modules so that they have material that they can continue to consult even after work with the SafeCare program has ended. So for example, in the health module, it's around helping parents assess symptoms when their young child has been hurt or when their young child is ill, and then working through a set of questions so that they can make really well-informed decisions about what is the best course of action to address this illness or this injury. So here's a scenario that a SafeCare provider would work with a caregiver. And then here is the sort of flow chart that could be used with a caregiver as a way to work through the symptoms. Because SafeCare is a US-based program, when we first started working with it in 2013, we ran the health module by several pediatricians at CHIO, and we updated it all to fit within our current Canadian healthcare system. For the safety module, what this involves is, with the permission of the parent, the SafeCare provider assesses 3 rooms in the home and comes up with how many hazards there might be. Hazards around suffocation, drowning, poisoning, strangulation, those sorts of things. And then with the caregiver helps to really make sure that those kinds of hazards are minimized as a way to avoid any kind of harm that could come to the child. So for example, these are some of the materials that would be reviewed with caregivers and that would be provided with caregivers so that they can consult over time. And then finally, with the parent-infant, parent-child interaction module, it's divided into young children that are more nonverbal and older children. But the objectives are the same in the sense it's around how to engage your child in a sensitive way, how to be responsive, how to be encouraging, and how to pick up on cues for the more nonverbal infants, and also for the older children, the 3 to 5, how to sort of structure their day as a way to keep them engaged, as a way to introduce predictability into the day, and as a way to sort of minimize challenging behaviors, which can come when a child doesn't really have a lot of routine in their day or many activities in which to engage. So here's an example of some of the work that would be done in terms of, preparing a child for an activity so that they can be successful, explaining the parameters of that activity, what the expectations are, and then during the activity, always connecting with the child physically through touch and through words. And here's an example of some of the resources that are provided to caregivers that kind of follow up on some of the skills that are taught through the SafeCare program. So SafeCare involves 18 in-home sessions, so 6 across those 3 modules. Each session is about 1 hour in length, and it's conducted within the family's home as a way to really make it easy for a parent to engage in the program because the provider comes to them. And also the home provides a naturalistic opportunity to really kind of have a sense of the environment in which the young child and their family are living. So there are 6 sessions in each of the 3 modules, and they all follow the same pattern. The first session is an initial baseline assessment. And this allows the provider to kind of gauge what the caregiver's initial skill set is, and then to use this information to really inform how to deliver the remaining sessions. So even though all the content has to be covered, if a parent is already showing quite a number of skills, whether it's around parenting, health, or safety, the material can be reviewed in a quicker manner. Versus maybe a parent that requires a bit more time to work through the material. Sessions 2 to 5 are sort of the teaching. And it's done in the same way, with the provider first explaining what the skill is and why it's important, what's the rationale, modeling the behavior, and then having the parent practice the behavior and receive some constructive and positive feedback. And finally, the last session is kind of a reassessment to really gauge the progress that the caregiver has made in that particular module. So is SafeCare trauma informed is a question that we get. It's not a program that addresses any past adversity or trauma in the life of a caregiver. But certainly, as I mentioned, that could be a service that's also offered to caregivers, perhaps as they're also engaged in SafeCare, or perhaps before or after. And that's a judgment that's made by the agency, who knows their families. It is, though, trauma informed in the sense that it recognizes that many caregivers have their own lived experiences of childhood trauma and adversity that have impacted their well-being and their functioning, and perhaps their ability to safely care for their young children. Also, providers enter into relationships with caregivers in a way that is collaborative, sensitive, respectful, transparent, and trustworthy, so that caregivers can feel safe, both emotionally and physically, hopeful, validated, and empowered. Is SafeCare evidence-based? Well, SafeCare is listed on several evidence-based clearinghouses, and so the level of effectiveness can vary depending on the clearinghouse and how they sort of do their rankings. I like this clearinghouse, the California Evidence-Based Clearinghouse for Child Welfare, because it has a reasonable approach to assessing efficacy, and it's also really focused on programs that are developed for families that are involved in child welfare. And what you'll see here is that the child welfare relevance ranking for SafeCare is high, as opposed to medium or low. And this is because when SafeCare was developed many years ago in 1979 under a different title, it used to be Project 12 Ways at that point. But from the beginning, SafeCare has always been developed with child welfare families in mind. And so it's quite attuned to the needs of these families. And all the materials are structured in that way. So it's not a program that's used in the community and that's just been transported to child welfare. In terms of the scientific rating, they can range from 1 being the highest rating to 5, which is it can't be rated. There's no evidence to suggest that it might be effective or not. And here it's rated as a 2 across several topic areas, meaning that it has at least one rigorous randomized controlled trial. The findings have been published and the outcome measures have been reliable and valid. So there are numerous publications that document the development and the validation of SafeCare. Research has shown SafeCare increases positive parent-child interactions, reduces hazards in the family home, and improves how parents care for their children's health needs. Randomized studies have also shown positive effects on several other outcomes, including reduced parental depression, reduced future child maltreatment reports, improved program engagement and completion, and increased program satisfaction. And I do find that the finding on future risk is especially important from a family preservation perspective. And finally, there are data showing that SafeCare is a cost-effective program. And in this particular analysis, which was done in 2019, what the findings showed is that the rate of return for every dollar invested was the highest for SafeCare of any child welfare relevant program that was evaluated in that year. And I believe there were about 10 or so other programs against which SafeCare was compared. So that's SafeCare in a nutshell. So what did we do in our first project? Well, we've been working with this program since 2013. And in our first project, it was really around implementation. So we were fortunate to get funding from the Canadian Institute of Health Research to really assess the implementation of SafeCare within a Canadian context, because it had not previously been introduced to Canada. And also to have a sense of outcomes based on caregiver self-reports. So in this particular project, we worked with 6 Ontario child welfare agencies. We trained 28 staff as SafeCare providers, and they were trained through the National SafeCare Training and Research Center. We were interested in caregivers' experiences with SafeCare, so we invited 30 parents to complete an interview. Also, as part of this project, we gathered information through focus groups with 9 service directors and 15 practitioners who were trained as SafeCare providers. Here, we really wanted to understand what it was like for agencies to adopt and implement and sustain a program like SafeCare. The other thing we did with caregivers is we collected self-report questionnaire data on parenting and parent mental health outcomes for the 83 caregivers that completed the program. Just a word here around who the providers were, who the parents were. The providers' backgrounds, they tended to be family support workers and child and youth care workers. And SafeCare doesn't really have any kind of requirements around what the backgrounds or the educational level of SafeCare providers ought to be. It's really around who works with parents in a way like that, like over a longer term period and from an intervention perspective. And that would be a good fit for a SafeCare provider. For the parents that participated, they were predominantly mothers. Average age was about 28 years. The number of children in the home ranged from 1 to 4 with a mean of 1.6. And the mean age of children in the home for this study was 1.7 years. The majority of caregivers in this study were white. Most were raising their children as single parents. And there was a pretty even split between caregivers that had and had not completed high school. The majority of caregivers were not employed outside the home. And in cases where a partner was living in the home, most were reported as not having completed high school and not having employment outside the home. And finally, the majority of caregivers in this study had an annual household income of less than $20,000, which falls within the poverty category for a single parent household in Ontario. But I'll start with the interviews that we did with the caregivers and the focus groups with the service directors and the practitioners. So the interview provided caregivers with an opportunity to share their overall experience with the program, as well as with each of the 3 modules. And the caregivers provided information on what they found most and least helpful about the program, examples of skills acquired, and suggestions for improvement. The majority of caregivers rated SafeCare as a positive and valuable program that they would recommend to other families. They reported that SafeCare enhanced their knowledge of caregiving skills and equipped them with practical strategies on how to create and maintain a nurturing and safe environment for their child. Caregivers also reported having become more confident, open, and mindful in their parenting role. In discussing general challenges, some caregivers mentioned that not having their child living with them on a full-time basis made it difficult to use the skills on a regular basis. And that some caregivers spoke about circumstances that made it challenging with regard to the consistent use of skills, such as having multiple children to care for in the home. For the health module, caregivers really appreciated having been provided with material that they could reference as needed. And this would have included things like the SafeCare Health Manual, all the health charts, so some of the material that I had introduced earlier on. Similarly, caregivers reported that they liked having a step-by-step procedure to assess the seriousness of their child's illness or injury as a way to really make informed decisions about the most appropriate course of action. For some caregivers, they found the health module was rather repetitive, so they made suggestions around condensing the information and presenting it in a briefer format. So here's a quote from a parent who says, "The SafeCare provider really gets you thinking when you need to go to the hospital, when it's an emergency, when you can care for the illness or the injury at home. Like if the children have 3 or more symptoms all at once, what would you do? If that was only one by itself, I would just be at home without hurry, but it's different when you put them all together." So just that sense of how to really evaluate the symptoms in a way to really gauge best next steps. For the safety module, the theme centered on knowledge acquisition and the development of practical skills. Caregivers really appreciated learning about hazards within their home, especially as there were many that they were not aware of. Also, caregivers reported that they benefited from learning practical skills to remove hazards that could cause harm to their child. In terms of the challenges, parents commented that it was sometimes difficult to follow through on creating a safe home environment because they did not have and could not afford to buy some of the supplies like the safety latches. Several parents also said that it made them feel uncomfortable to have their SafeCare provider look through the rooms of their home for safety hazards, but that they came to understand the practical utility of the home assessment, despite its intrusiveness. And that was just a quote. I'll just go on to the next one. For the parenting module, with respect to this one, the caregivers reported that SafeCare really helped them learn about the importance of routines and activities for children, and then how to practically set these up within their home. Parents also reported noticing an improvement in the relationship with their child, which some attributed to feeling better equipped to handling the stresses of everyday parenting. The one challenge that most parents had is adapting the module to meet the specific needs of some of their children, especially those with strong behavioral challenges. And I do want to present this quote because I just love this quote, and I really enjoy the opportunity to present it every time I can. So this would have been for a caregiver of an infant who says, "I didn't know that, like while feeding my daughter and changing her, that if you look into their eyes, that they seem to, I don't know, they seem to be better. Like changing, she'll sit still. While feeding, she won't move all over the place. I didn't actually know that before. I mean, a lot of the times I would just sit here and feed her, and watch the TV and whatnot. So, but now she feeds herself. But when that was happening, I started looking into her eyes more often." With regards to the focus groups with service directors and SafeCare providers, overall, SafeCare was found to provide a good fit with the agency goals of providing evidence-based interventions to address child neglect. Service directors and providers expressed enthusiasm about implementing SafeCare in their agency, and they were pleased with its impact on families, staff, and the agency as a whole. These stakeholders reported various gains for parents who completed the program in terms of improvements in family stability. They noted gains for the trained staff in terms of enhanced skills for working with families. And they noted gains for the agencies in terms of changing views toward evidence-based practice. These stakeholders also appreciated the structured and skills-based approach, as well as the flexibility within that structure to meet the diverse needs of families. Service directors described SafeCare as a vehicle for changing views and increasing enthusiasm among practitioners. They also noted that SafeCare helped steer the agency toward evidence-based child welfare practice. Turning to challenges, service directors and providers discussed difficulties around the structured nature of SafeCare. Namely, some providers felt limited in their opportunity to discuss issues with parents in a more individualized way. These stakeholders also spoke about challenges related to readiness and comfort with certain program delivery elements, such as audio recording sessions with families for training and program fidelity monitoring. So that was important to do as part of the certification process, and it caused some uneasiness for the SafeCare providers. Finally, some practitioners expressed challenges on working with families with unique needs, such as those with limited English speaking abilities, mental health difficulties, or socioeconomic difficulties. That's what we found from our qualitative data. I'll just quickly review what we found with our quantitative data collection and then move on to our current project and just give you a bit of an overview of that. So as part of examining parenting outcomes for caregivers who completed SafeCare, we also administered standardized measures at pre and post SafeCare and then at 3 months after the completion of the SafeCare program. For parenting, we looked at things, constructs around neglect, physical punishment, positive disciplinary strategies, and psychological aggression. We didn't find any differences with regards to psychological aggression. But for the others, parents reported a statistically significant decrease in neglectful parenting practices that remained at 3 months post-program. There was also a significant decrease in the use of physical punishment from pre to post program, and a significant increase in the use of positive discipline that remained at 3 months post program. We also wanted to examine, as has been done in other SafeCare research, any kind of gains in well-being that might have been experienced by the caregiver who completed SafeCare. So here again, we administered some standardized questionnaires pre and post and at follow-up. Here we looked at anxious/depressed symptoms as well as parental aggression. There weren't any changes in aggressive behavior, but the scores were already quite low to begin with, so we probably had a floor effect here. We did find, however, that caregivers who completed SafeCare showed improved well-being as it relates to a decrease in anxious, depressed symptoms from pre to post program. So that's sort of a summary of what we did the first time we worked with this program and the first time that we had a research project around this program. So what are we doing now? I mean, those implementation and outcome findings that we were able to show, to me anyways, indicated that SafeCare can be a powerful program for some families with young children. So we decided to get together and prepare another grant. And we, again, were successful and quite fortunate to get another CIHR grant. In this project, our attention has really moved away from implementation to really kind of dissecting the program a bit more around how it works, for whom it works better, those sorts of questions. So this project is still in its early stages, in large part because of the challenges of the pandemic. We do have funding until 2026, so that's reassuring. And as you can see here, it's a pretty big project. And so it's brought together a number of researchers and students. Basically, we have 3 research questions. Our first one is around differential outcomes. So although we know that SafeCare is evidence-based, it's clear that not all parents will benefit to the same degree. So one of our questions is around what is it that might moderate some of those impacts? And we're going to look at things like perhaps circumstances that are currently around these families, like financial challenges, social support, and also maybe some of the circumstances in the background of these caregivers in terms of adverse childhood experiences. Our second research question is really around mechanisms of change, so mediators. What is it that might explain some of the benefits that families are deriving from the program? And here we have hypotheses around that maybe SafeCare will help in terms of parenting stress, in terms of emotion regulation and executive functioning. And then our third question is, what happens over the longer term for families that have completed SafeCare? And to what extent do these families continue to have concerns related to child safety? To answer these questions, we have a really rigorous data collection procedure in place. We're hoping to follow families before they begin the program to 1 year post-completion. And we have a variety of instruments from self-report, interviewer-administered cognitive tasks, videotaped observations, as well as hair and saliva samples. Currently, we have partnerships with 5 Ontario child welfare and community-based agencies, as well as 1 child welfare agency in Manitoba. But we continue to be in discussions with other Canadian provinces and territories, and are possibly looking at a partnership with Australia as well, as SafeCare is being used worldwide, and there is an agency in Australia that's been working with the program for a number of years now and has expressed an interest in collaborating with us on the project. Thank you all very much for your attention and for being here today.